So I'm excited to present this information because even though I do not have any children who have this specific diagnosis, I do have close friends and family members who do, and either with their children or adults with autism spectrum disorder. And I feel like there is a lot of misunderstanding about the disorder. There is a lot of rumors, myths, things like that kind of floating around. And so I hope today will be informative and give you some clarification on the realities of this disorder, and the people who are living with it. Again, I think education is our best resource when it comes to cultivating compassion and empathy for others. The better we understand why someone behaves they do, the better equipped we are to assist them to meet their needs and to maintain our own stress levels. Especially if you're caregiving for someone who has high needs, whether it's an autism diagnosis or otherwise. You all know how very depleting that can be, and it's difficult to not take some behaviors personally. And so I really hope that today, by the end of it, you can recognize some symptoms maybe and realize that it is the disorder, it's not the person, or it isn't misbehavior, things like that. And so I really hope that this information cultivates compassion in you today. Many of you have already heard this information, maybe you've researched it for your children, and so this will be a refresher. Some of you may be brand new to the diagnosis and you just aren't really sure where to start, and so this crash course is designed for you to just kind of give you a broad overview of the diagnosis, and maybe you can notice a few things that you've seen your loved ones doing, and you thought maybe it was misbehavior, or you weren't really sure where those behaviors are coming from, and maybe this will clarify some of that for you. So I'll go ahead and get started. We do have a lot of people in today, so thank you for coming. And if you're just joining us and you have yet to do so, please put your email in the chat so that I can send you your post survey and get your feedback. I do have a lot of information to go over today, but I do want to leave things open for questions at the end. So if you have any and you need to jot them down in the chat, please feel free to do so. Otherwise, you'll have a chance at the end to ask any questions or give us any insights, or share some wisdom if this is a journey that you've been on for a while with others who maybe are just getting started. So speaking of getting started, before we begin, I want to clarify that I am a social worker. I'm a researcher. Okay, I am not a licensed medical professional. I'm not a psychologist. I'm not a behavioral therapist. So the information I've gotten for you today is through peer-reviewed scholarly sources, but I am not a medical professional, and any information I give you today should not be used to diagnose or treat any disorders. It's for education solely, okay? And I do have a list of my references at the end, which I will show briefly, and if you want those references, please let me know and I'll send them to you through an email. This can just act as a starting off point for you to do your own research, to ask your own questions with your own medical professional, okay? So like I said, we have a lot to go over today, so my agenda is a little longer than it normally is. We're going to define autism spectrum disorder. Throughout the presentation, you'll hear me use the term ASD, and that's just an abbreviation for autism spectrum disorder. We're going to debunk some of these myths and misconceptions that are floating around for autism. We're going to talk about the signs and symptoms of autism. We're also going to talk about causes and risk factors. We're going to briefly talk about how it's diagnosed in children, adolescents, and adults, because it is a little different. We're going to briefly discuss the treatment options that are available. And then we're going to talk about caregiver tips, including autistic behaviors versus misbehavior. And then we're going to spend some time talking about autistic meltdowns and how to, and some tips on how to navigate those, okay? So first things first. Oh, hold on, first things second, because now I just messed up my screen. Hold on, okay. Okay, so what is autism spectrum disorder? So it is a neurological and developmental disorder that affects how people interact with others, how they communicate, how they learn, and how they behave. So autism can be diagnosed at any age. It's described as a developmental disorder because symptoms will generally appear within the first 2 years of life. People of all genders, all races, ethnicities, economic backgrounds, they can all be diagnosed with autism. It can be a lifelong disorder, but there are treatments and services that can improve a person's symptoms and their daily functioning. And the American Academy of Pediatrics recommends that all children receive screening for autism. Caregivers should talk to your child healthcare professional about screening or evaluation, okay? So let's go ahead and crack open some of these myths and misconceptions. I was actually surprised at some of these because to me, some of them kind of seemed a little cruel, but these are just things we have to address, right? So the first one is the appearance of autism is relatively new. But the truth is, autism was first described by a scientist named Leo Cranner in 1943, but the earliest description of a child now known to have autism was written all the way back in 1799. Ongoing research and improvements in diagnoses has identified that the characteristics of autism exist on a continuum with varying degrees of severity, intensity, and frequency. So that just basically says one size does not fit all, right? In 2014, the CDC estimated that 1 in 68 children in the United States have a diagnosis of autism spectrum disorder. So it is fairly, hold on one second. It is a fairly common diagnosis as far as the spectrum disorder, okay? Myth number 2, autism is a mental health disorder. Well, the truth is it is a neurological disorder, okay? So, sorry, being distracted here. Okay. Studies of people with autism have revealed abnormalities in the way the brain is structured and the neurotransmitter levels. So if you remember, the neurotransmitters are just the chemicals that allow our brain to talk, to communicate with itself, okay? So there's abnormalities in the levels of neurotransmitters. What is commonly overlooked, though, is that individuals with developmental disabilities are twice as likely to have co-occurring mental health disorders that also need treatment. Or at times it might render them in need of acute mental health stabilization. That would be, just a very as needed stabilization. So not everyone who has autism has a mental health disorder, but studies are finding that they commonly occur at the same time. So not everyone with a mental health disorder has autism, and not everyone with autism has a mental health disorder. Myth number 3, all individuals with autism have mental disabilities. But the truth is, individuals on the autism spectrum are unique with a wide range of intellectual abilities. Individuals with autism can be harder to test, so IQ and abilities can be under or overestimated unless testing is done by an expert in intellectual and developmental disabilities and or autism. Tests designed to include language and interpersonal analysis might misrepresent, the intelligence of people with autism who struggle with social skills. Many individuals on the autism spectrum have earned college and graduate degrees and work in a variety of professions. Conversely, it is sometimes mistakenly assumed that an individual with autism has a higher level of understanding than they do based on their behavior, language skills, or high level of ability in a specific area. Next, autism is caused by vaccines. This is the big one. There is really no evidence that childhood vaccination causes autism. There was a 1998 study linking autism with vaccines, but that has since been retracted, and numerous studies continue to confirm that there's no direct evidence that links vaccines to the development of autism. That was probably the most common misconception that I was aware of. And I know a lot of people still believe that, even though it has been debunked several times. So hopefully this, closes the book on that myth. Next, autism is caused by poor parenting or quote unquote refrigerator mothers. So the truth is, in the 1950s, there was an assumption that autism was caused by emotionally distant or cold parents. But the exact cause of autism has not been determined yet, but it is now firmly established that the development of autism has nothing to do with your parenting style. Okay, remember, this is a neurological disorder. It is not a behavioral disorder. Okay, so it has nothing to do with your parenting style. Next, autism is caused solely by environmental factors. Well, the truth is there are genes that have been identified as one of the causes of autism. Parents whose first child have autism are more likely than the general population to have a second child with autism. So that indicates genetic factors. And identical twin studies have shown that if one twin has autism, the other one has a 90% chance of having autism as well. So environmental factors don't cause autism, but they can contribute to the severity of symptoms in some individuals, and we'll clarify that later. Next, individuals with autism are violent. The truth is, there may have been some recent news stories relating autism to violence and aggressive acts, but it usually arises from a sensory overload or emotional distress. And it's very unusual for individuals with autism to act violently out of malice or pose any danger to society, just like everybody else. Many individuals actually prefer to limit their exposure and interactions with other people because they find social situations confusing and anxiety provoking. Next myth, all individuals with autism have savant abilities. Now, if you're in my generation or a little older, you probably remember that movie with Tom Cruise and what's his name? Dustin Hoffman. And Rain Man was the name of the movie. And that was kind of, you know, our culture's first major mainstream exposure to autism spectrum disorder. And the character in that movie, he had savant abilities. And so everyone just assumed everyone with autism has savant abilities. So the truth is there's a higher prevalence of savant abilities among those with autism, but only about 10% of individuals with autism exhibit savant abilities. Some individuals with autism have what we call splinter skills. And that means their skills in one or two areas that are above their overall performance abilities. Okay, so they might have savant-esque, I guess, if that's a made-up word I just came up with, type abilities. And when you compare it to their other abilities or other performances, but that doesn't mean that everyone with autism has savant abilities. Next myth. Individuals with autism do not feel love and they are unable or unwilling to form meaningful social relationships. This one I didn't really quite understand unless you don't know anyone with autism. Maybe you would believe this, but I feel, you know, human beings are human beings regardless of diagnoses, and we all have the capacity to form meaningful social relationships. It just may be a little bit different for people who have autism. So the truth is many individuals with autism have a difficulty with social interaction, but they can have close social relationships, fall in love, raise children, and some people may express their loving feelings in less obvious ways, but it doesn't mean that they're incapable of experiencing or expressing love. One term that kind of floats around, I'm not sure if it's a technical term or not, but it's called neurodiversity. And what that means is we have neurotypical brains where, you know, our formations and our neurotransmitter levels are at what we typically would expect from a human brain. But then there are people who have a divergence from that makes them neurodiverse. So it doesn't mean that they can't do or they lack the ability to have the same emotions and responses that typical people do. They just do it in a different way. Okay. Next myth. People with autism are cold and lack empathetic feelings. If you know anyone with autism, you know this could not be further from the truth. Individuals with autism feel as much, if not more, empathy as others. But again, they may express it in ways that are harder to recognize. Some individuals with autism may seem cold or uncaring if they're very anxious, or if they expect to show care and empathy in a more typical way. Okay, so again, it's not that they don't have the capacity, which I think is a very cruel overgeneralization. It's just not typical in the way that a neurotypical brain would experience or express these emotions, but that doesn't mean that they're not there. Next, people with autism can't stand to be touched. Well, the truth is it can be true for some people who have high sensory sensitivities, but many individuals with autism enjoy hugs, light massage, and other forms of touch, just like everybody else. Next myth, people with autism have no sense of humor. The truth is that this may be true for some people with autism, but it's more likely that the individual expresses or shares humor in a unique or less obvious way. Many parents report that their family members may tease, tell jokes, or mimic comedy actions or comedy lines appropriately, anticipating that others will be entertained. Now, I do know some people who are neurotypical who have no sense of humor, and it could just be a personality trait. It doesn't have to be a trait of autism, okay? And finally, autism can be cured. Well, the truth is there's no current cure for autism spectrum disorder. However, early and intensive behavioral treatment can, in many cases, reduce the severity of symptoms and help individuals develop adaptive skills for daily living, emotion and behavior regulation, and social engagement. Okay? So there's no cure, but there are definitely ways that we can make things a little easier for our loved ones who have autism spectrum disorder. So let's go through some signs and symptoms. So first category of signs and symptoms are going to be social communication and social interaction behaviors. Some of these you may recognize in your loved one, and maybe you didn't know that this was an autistic sign or symptom. And so hopefully this will give you some clarification. So social communication and interaction skills can be challenging for people with autism spectrum disorder. And that can look like making little or inconsistent eye contact, appearing not to look at or listen to people who are talking, and frequently sharing interest, emotions, or enjoyment of objects or activities. This is typically more in like your younger group, including infrequently pointing at or showing things to others. Not responding or being slow to respond to their name or to other verbal bids for attention. So maybe you're trying to get your child's attention and they're not responding or they're slow to respond. That could be a sign or a symptom of autism. Having difficulties with back and forth of conversation, often talking at length about a favorite subject without noticing that the other people they're talking to are not interested, or they don't give them a chance to respond to what they're saying. My children, I have 5 children and they all have a diagnosis of ADHD, and they do this to me all the time. So if you have a person in your life who often talks at length about things that you just really have no interest in, I feel your pain. Next, displaying facial expressions, movements, and gestures that do not match what's being said. Having an unusual tone of voice that may sound sing-songy or flat and robot-like. Having trouble understanding another person's point of view or being unable to predict or understand other people's actions. Again, these are social communication issues that they have trouble with. Difficulty adjusting to behavior and to different social situations. So if they're in a social situation that requires a certain expected behavior, they may have a difficulty adjusting to that behavior because, we act differently at home than we act at church, right? Well, someone on the spectrum may not understand those social cues, okay? And finally, difficulty sharing in imaginative play or making friends. Again, this is probably more for the younger group. But this is one of the things that they'll screen you for, and we'll go through the screening as well later on. Next, we have restrictive and repetitive behaviors. People with autism spectrum disorder have behaviors or interests that can seem unusual. And these behaviors or interests set ASD apart from other conditions defined by problems with social communication and interaction only, okay? So before we had a list of symptoms for autism spectrum disorder, but they, just those symptoms alone would not be sufficient for a diagnosis. There's gotta be other things and like restrictive repetitive behaviors. And so that looks like repeating certain behaviors or having unusual behaviors like repeating words or phrases. This is a behavior called echolalia or echolalia. I think that's how it's pronounced. I looked it up and everything and now I forget, but it's on the screen so you can look it up. Having a lasting intense interest in specific topics such as numbers, details, or facts. So obsessive interests. I had a neighbor who was an adult man in his 40s. He was very forthcoming with his autism diagnosis, and he would often come over and talk to my husband and I about plants and a lot of really great information, but that was like all he wanted to talk about. And so that's just part of the disorder. Showing overly focused interests, such as with moving objects or parts of objects. This is apparent throughout the age groups, but it's more often seen in young children. Maybe they're hyper-focused on maybe spinning wheels of their toys or flashing lights, things like that. Becoming upset by slight changes in a routine and having difficulty with transitions. Being more sensitive or less sensitive than other people to sensory input, such as light, sound, clothing, or temperature. And people with ASD may also experience sleep problems and irritability. And other characteristics that are related to people with ASD: delayed language skills, delayed movement skills, delayed cognitive or learning skills. Of course, we're thinking more about our children at this point. Hyperactive, impulsive, and or inattentive behavior, epilepsy or seizure disorder, unusual eating and sleeping habits, gastrointestinal issues, for example, constipation, unusual mood or emotional reactions, anxiety, stress, or excessive worry, and lack of fear or more fear than expected. But people with ASD also have many strengths, such as being able to learn things in detail and remember information for long periods of time, being strong visual and auditory learners, and excelling in math, science, music, or art, just to name a few. So now we're going to move on to causes and risk factors. So researchers don't know the primary causes of ASD, but the studies suggest that a person's genes can act together with aspects of their environment to affect development in ways that lead to ASD. Some factors that are associated with an increased likelihood of developing ASD include having a sibling with ASD, having older parents, having certain genetic conditions such as Down syndrome or Fragile X syndrome, having a very low birth weight. But again, not everyone who has these risk factors will develop autism spectrum disorder. It's just as the research continues, these have been factors that they've noticed that are common. So how is autism diagnosed? Well, in young children, it's often a two-stage process. So your primary care physician will always consider your experience as a caregiver and your concerns as an important part of the screening process for young children. Healthcare provider might ask questions about their behavior and then evaluate those answers in combination with information from their own screening tools or their own clinical observation of the child. So it's very important for the caregiver to be included and involved in the diagnosis process. So if a child shows developmental differences in behavior or functioning during the screening process, your healthcare provider might refer your child to additional evaluation. One of the things that I've heard from friends of mine who are seeking a diagnosis for the child, it seems like it's a never-ending process. And I understand your frustration. Please understand that the medical community doesn't want to just throw a diagnosis at you, especially when there are several different symptoms of autism spectrum disorder that look like other diagnoses. And so please bear with them. Please show patience. I promise you that they're trying to do the best that they can. And if you think that your provider isn't doing the best that they can, by all means, find a new one. Okay, you don't have to be stuck with whoever you're stuck with. So stage one, general development screenings during well-child checkups. So every child is going to receive a well-child checkup with their pediatrician, typically within the first year of life, and then they'll see, every couple months, and then after that, it's usually every year. And so everybody, hopefully, the suggestion is that every child is getting screened for autism. They're going to try to look for developmental delays at their 9-month, 18-month, 24, or 30-month well-child visits, and then specific autism screenings at the 18 and 24-month well-child visits. So a child may receive additional screenings if they're at high risk for autism spectrum disorder or if they have developmental problems. In children, young children, sorry, lost my train of thought. Stage 2, can you tell I'm having a slow morning? I apologize. So there's additional diagnostic evaluations. So there's medical and neurological examinations that can take place. Assessment of the child's cognitive abilities, like what is their developmental functioning as far as their understanding, assessment of their speech and language abilities, observation of their behaviors, of course, an in-depth conversation with you, the caregiver, about their behavior and their development, assessment of age-appropriate skills needed to complete daily activities such as eating, dressing, and toileting, and questions about the family's history. Because it is a complex disorder that sometimes occurs with other illnesses or other learning disorders, the evaluation may include blood tests and hearing tests. The outcome of this evaluation may result in a formal diagnosis and recommendations for treatment. And so you typically want to have a team of healthcare providers who have experience diagnosing autism spectrum disorder. That could be a child neurologist, developmental behavioral pediatricians, speech and language pathologists, child psychologists and psychiatrists, and educational therapists or specialists and occupational therapists. Now, not everybody's going to have, a team of 12 people that is focusing just on their child. But it does take more than just one person to say, yes, this is the disorder, this is the diagnosis. It's typically evaluated on several different levels. So diagnosis in older children or adolescents looks a little differently. So it's usually the caregiver or the teacher, if your child goes to school, that's going to recognize the symptoms of ASD. A school special education team might perform the initial evaluation and then recommend that the child goes through additional evaluation with their primary healthcare provider. A child's caregiver might talk with those healthcare providers about the child's social difficulties, including problems with subtle communication. These subtle communication differences may include problems understanding tone of voice, facial expression, or body language. And older children and adolescents may have trouble understanding figures of speech, humor, sarcasm, things like that. And they may also have trouble forming friendships with peers. Now, again, that doesn't mean that they have no capacity to develop relationships with peers. It just means they might need a little bit more assistance to recognize what that looks like, okay? And how do you diagnose it in adults? Well, it's often more difficult to diagnose with adults than it is in children. And some symptoms can overlap with other symptoms of mental health disorders like anxiety disorder or ADHD. So adults who notice signs and symptoms of ASD should talk with their doctor about it and ask for just ask for a referral to be evaluated. Although the evaluation for autism spectrum disorder in adults is still being refined, adults can refer to a neuropsychologist, psychologist, or psychiatrist who has experience with ASD. And so those experts will often ask you about your social interaction and communication challenges, any sensory issues you may have, ask if you have repetitive behaviors or restricted interests. And so obtaining the correct diagnosis as an adult can actually help them understand past challenges. I know for my children, and again, it's a different diagnosis, but there's a lot of bleed or crossover between ADHD and ASD. Just learning that their behaviors that they struggled with wasn't a character flaw. It wasn't something that they just couldn't get. It was part of their diagnoses. And that is huge for someone's self-esteem to know that this is something that, they need to redirect how they handle these situations. And it's not something wrong with them. Okay. It's not a character flaw. It's just their disorder. And so that can be great for adults who have maybe felt out of place their whole lives to finally get that aha moment. So now we're going to talk about some treatment options for autism. So people with autism spectrum disorder may face a wide range of issues, which means there's no single best treatment for autism spectrum disorder. So that's why it's important to work closely with your healthcare provider and find the right combination of treatments and services. And we should begin as soon as possible after the diagnosis happens, whether that's for children, adolescents, or adults. As soon as you know that this is what's going on, it is advisable to start early treatment because proper care and services will reduce the individual's difficulties and helping them learn new skills and build on their strengths. People with autism spectrum disorder might have problems with irritability, aggression, repetitive behavior, hyperactivity, attention, anxiety, and depression, and there are medications to address all of these symptoms. So they are not autism-specific treatments, they are symptom-specific treatments that you can, have experiences with whether you have autism or not. Next, people with autism spectrum disorder may be referred to a healthcare provider who specializes in providing behavioral, psychological, education, or skill building interventions. These programs are typically highly structured and intensive, and they may involve caregivers, siblings, and other family members. And they can help people learn social and communication skills, language skills, reduce behaviors that interfere with daily functioning, which we'll go over some more of those behaviors later. Increase or build on strengths, which I think is important for everybody, regardless if they have a diagnosis or not, and learn life skills for living independently. So I hope you're kind of seeing this picture here where you can have autism and still lead a independent, fulfilling, happy life. It is not a death sentence, okay? It just takes a little extra care and a little extra effort, but it doesn't mean that you cannot go on and live your life, or your children cannot go on and live their lives independently and successfully. Of course, again, it's a spectrum. So there are people who have higher needs than others. And so your results may vary, but there are treatment options to make things easier for the individual, okay? So here's some tips for you all as caregivers. If you're caring for someone with autism, learn how to communicate with them, okay? So many people with autism, communication is challenging. Some children with autism are nonverbal, and so you have to be creative in finding ways to communicate with them. And visual communication tends to work really well with those children. Next, be patient, right? Patience is vital when caring for a person with autism. Their social and communication skills are often underdeveloped, and it can be hard to get through to them. But that doesn't mean it's impossible. So we just got to be patient and keep trying. Next, create a schedule and stick to it. So children with autism and adults benefit significantly from a structured schedule. Any deviation to the schedule could throw them off, however, and so you need to make sure that you let them know beforehand if things are going to change. Children with autism tend to thrive with consistent schedules, including meal times and bedtimes. And so again, if you're going to have a shift in that schedule and that structure, just let them know ahead of time so they can have time to process that change. And finally, schedule time for play. Often we get so busy with school and therapy that your kid can get overwhelmed with all of that. And so it's a great idea to schedule time to unwind and play. It could be a little tricky trying to figure out what your child likes to do for fun, as they're unlikely to unwind in the same way as other children or typical children. But that doesn't mean that it's impossible. You know your children, you can ask them questions and observe what they enjoy and just try to incorporate that playtime into their daily routine so that they can have that decompression time, just like we all need, right? Many of the common behaviors seen in children with autism might be deemed problems in other kids. So here's some examples. Children with autism might screech or yell when they're overwhelmed or frustrated. They might bolt from the room, hit others, or even injure themselves when they're upset. Maybe they don't look directly at a person while they're speaking. They might rock, flick their fingers, or pace when they're expected to sit still. They may seem self-absorbed and inattentive to events or emotions around them. In school, children with autism might overreact or underreact to other people's requests or needs. So an example would be pushing other children in line or ignoring requests to move or to hurry. And they may have difficulty responding to kindness. So children with autism might have a tough time managing their responses to adult or peer kindness. So here's a few examples that might sound familiar to you if you are a parent to a child with autism. The grandparent comes to visit, they see their grandchild, they open their arms, ask for a big hug, and the grandchild runs in the opposite direction at top speed. The grandparent follows them, gives them the hug, only to be rewarded with a kick in the shins. Another example, grandparent gives their grandchild a gift, and the grandchild, who is at an age where it would be, they would know better on how to respond, they might say, I didn't want this, I wanted a blank, right? I didn't want this Barbie, I wanted, Play-Doh. Or a peer from school agrees to come to a play date and they find themselves being ignored for several hours while your child with autism plays alone. Or they might spend 2 hours being told, don't touch that. So all of these behaviors can lead to hurt or even angry feelings, yet all can be autistic traits. And in most cases, they're just results from a sensory, communication, or behavioral challenge that's common with people with autism. So this leads us into our next category, which is distinguishing autism from misbehaving. So autistic behaviors are usually the result of a few very specific types of challenges. So because every person with autism is unique, the challenges will look different for each child, but they exist at some level for anyone who's correctly diagnosed with autism. So sensory challenges. People with autism are almost always likely to either overreact or underreact to sound, light, smells, and touch. The child who runs away from their grandparent might actually be responding to the smell of their cologne or their perfume. And a child who hates hugs might just not like the sensation of being squeezed, but actually feels affection towards the person doing the hugging. Okay, just keep in mind, autism spectrum disorder is a sensory processing disorder. Okay, so the way that they are experiencing the world and interpreting the world is not going to be in a typical way compared to the general population. Okay. So it's not always about being rude or misbehaving. Okay, it's just the way that they're interpreting the sensations that they're feeling. So a sensory challenge could be something as minor as the buzz from fluorescent lights. A sensory challenge could be the reason why they're quote unquote misbehaving when they're in a crowded or loud auditorium or squeezed between people standing in line. So how can you tell when a sensory issue is causing a problem? You can take these steps. So you can ask if the child is verbal, you can just say what's going on, and they can be perfectly capable of explaining why they're behaving the way they are if they're asked. You can watch your child. If the child is covering their ears while they're bolting from the room, you can reasonably assume that something about the sound in the room is causing that problem. And keep tabs on behavior. So if your child is usually able to handle like a worship service, but then on one occasion becomes loud or runs out of the room, it's probably because something specific has occurred to cause that behavior. But if the behaviors are consistent, that means there might be an ongoing sensory challenge in the environment. Okay, maybe especially if you're in one of the more if you're a churchgoer and you go to one of the more modern churches where they've got the lights and the stage and all that stuff going on, if you have a sensory processing disorder, that can be very unnerving and unsettling for you. Here we go. Social communication challenges. So people with autism have a tough time with social communication on one level or another. It can be difficult or even impossible for them to read another person's emotions, and it may be very difficult to avoid overreacting to another person's feelings. It can be very tough to watch and imitate another person's behaviors. Typically, that's how children learn to behave in their society, is they watch other people behave and then they mimic that behavior. A person or a child living with autism may not be able to distinguish those subtle cues and apply it to their own behaviors. So the fact that other children are sitting still and being quiet, it might not register for that child who has autism. Notice the child's intent though, right? So difficulties with social communication can make it hard for a child with autism to tell when their actions are hurtful. So walking away from somebody talking because they're bored or a desire to do something different, it might look mean-spirited to the person who's seeing that, but there's a very good chance that the child doesn't even recognize how that behavior is affecting another person, okay? Remember that children with autism have developmental delays. A neurotypical 12-year-old should be able to graciously thank a grandparent for a gift that they don't want, but a typical 8-year-old might not be able to handle the situation as well. So autistic children often appear immature for their age, and an autistic teenager may behave like a much younger child, okay? But that doesn't necessarily mean that they're misbehaving. And then being aware of how instruction is provided is crucial. So let's say that a teacher is saying that your child is misbehaving at recess because they're pushing in line or taking extra turns on the swings, but to a child who has autism, and they rarely learn through imitation, so they will need direct instruction on behavioral expectations. So did the teacher actually tell the child about the rules of recess play? Did they provide visual supports or social stories? If not, how is your child expected to know the rules? Okay. So again, it's not that these behaviors or the expectations cannot be learned. It's just not going to be as natural to a child with autism to notice what other people are doing and follow that line of behavior. Behavioral challenges. So autistic behaviors are usually self-evident because they're generally quite different from neurotypical behaviors. So as a result, you as a caregiver should be able to tell at a glance whether they're seeing misbehavior or traits of autism. So here's some things you can look for. Self-stimulation or stimming. Many people with autism use physical behaviors such as rocking, pacing, flicking their fingers, humming, and that's all to calm themselves or to stay focused. So when you see those behaviors, you can almost be certain that that is not a misbehavior, that that is a child trying to self-soothe by using those behaviors, okay? Lack of eye contact. So maybe this isn't as big of a deal as it was when I was growing up, but I know my grandmother was very much a stickler on you need to look me in the eyes when I'm talking to you. It's a form of disrespect to look away. But people with autism, they struggle with this. It can be difficult, it could be impossible, especially during a conversation. So you can teach a person with autism to maintain eye contact. But it's going to be a little more difficult for them, okay? And it doesn't mean that they're being disrespectful, okay? It's just, it's difficult, more difficult for them. Self-abuse. So in some cases, particularly but not exclusively for people with autism who have high support needs, self-abuse can be common. So this can look like banging their head, picking at their skin, other behaviors that are not intentional, that they can become harmful and should be managed, okay? Next, lack of focus or attention. So people with autism might find it easy to focus on one thing, but tough to focus on others. And this could be why some people perceive it as a behavioral issue. Be like, well, you can't pay attention in your schoolwork, but you can pay attention to your video game, right? That doesn't mean that they're misbehaving. They're just having a difficult time focusing or putting their attention where it needs to be put. And oftentimes they are paying attention without appearing to do so. So sometimes they're not able to pay attention because they're having a tough time following rapid speech or abstract ideas. And very rarely are they intentionally ignoring this person who's speaking. Last, we have noise making or bolting. So children with autism can make noise or leave the room just to be annoying, right? Like most kids, but it's highly likely that they're doing it for other reasons. So maybe they're screeching, humming, or chattering to calm themselves, or bolting from a room to get away from some disturbing situation. Like maybe the lights are buzzing and it's driving them up a wall and they just got to leave the room. So you can usually tell the difference though between misbehavior and autistic behaviors, okay? According to one study, avoiding eye contact is a way for a person with autism to decrease an unpleasant sensation caused by an overactivation in one particular part of the brain. So I have a friend of mine who she's in her 30s, and she'll tell me that when she has a conversation with someone, she'll stare at the middle of their forehead. That was a trick she learned in her therapy growing up, because then the person she's talking to them, it looks like she's looking at them. But to her, she's staring at their forehead because looking at them in the eye just makes her feel uncomfortable. And that's why it's that overactivation in the brain, okay? So how do we address autistic behaviors? So you've determined that your child behavior is not misbehaviors, but they are an expression of an autistic trait. So now what? You can, of course, do nothing. And in some cases, that's perfectly reasonable. So why shouldn't a child with autism rock, flick, or pace if they're not hurting anybody and they're not creating any problems for themselves? Why bother them? Sometimes, though, autistic traits, while they're not intentional, can cause significant issues, especially during class. They can cause embarrassment for both the child and for you, and they can create hurt or even angry feelings or lead to a child being ostracized or excluded from an important group or an activity or setting. So how can we take action? So depending on the important situation, their abilities and challenges, and your philosophy, this can act as a framework for how you respond to those behaviors. So providing direct instruction. If a child is able to respond to and act on instruction, provide it. Use words, video, practice like rehearsing, modeling, and social stories to teach the child how to behave, like in church or at a concert, how to respond politely to grandparents, or how to interact at a birthday party. They might not come naturally to your child, but in many cases, instruction and repetition can be keys to success, okay? Next, you can remediate challenges. You can maybe to the grandparent who's wearing that strong perfume and it's causing their grandchild to run away, you can just say, hey, can you not wear that perfume? It's causing problems for your grandchild. Similarly, you can make life more comfortable by not squeezing a child with autism who doesn't like hugs. You can change fluorescent lights if that's causing the problem. You can turn down the sound level on the TV. And you can ask for similar accommodations in school, though it might not be as easy to do so, especially when you've got those overhead lights and stuff. But it doesn't hurt to ask. Okay. I remember the job I had before this, I was a suicide prevention educator for the public school system here in Huntsville, and several teachers had just turned off the overhead lights and they brought in other lighting so that it was a more calm and not a sensory overload situation for their students. And so there are accommodations that can be made, especially as more people become aware of autism and more aware of the challenges people with autism face. Accommodations are becoming more frequently used in classroom settings. So that's good news. Hold on, where did I close my? There we go. And you can choose settings and situations with care. So if your child who has autism hates loud movies, don't go see loud movies. A pair of noise blocking headphones might be the solution, right? To make it more comfortable for them. You can go to autism friendly events. I know there's several that take place here in Huntsville. I know we're all from around the state, so your options may vary, but there are autism friendly events for your children. Or you can select instructors who better understand children with autism, okay? Next, you can just grow a thicker skin, okay? Safety and comfort of your child is more important than anyone's embarrassment, including your own. So guardians, caregivers, parents, children who have autism are occasionally likely to experience situations that draw attention to you, right? Maybe your child is having a meltdown in the grocery store or they're taken off during their doctor's visit, okay? But your best bet is to just grow thicker skin, okay? And if you're having a difficult time processing the embarrassment or what have you that you're experiencing with those behaviors, maybe, talk with somebody that can help you process those things, okay? Whether that's a professional, a friend, a support group, okay? There's all kinds of options for you to verbalize your frustrations and decompress without taking it out on your child, okay? And finally, if the situations are super extreme, change the situation completely. So if their school, their home, their activity choices, or location is causing an issue that just seems to be consistent, you might need to change that. So it might be an extreme response, but if their school is unable to serve their needs, maybe look for private school options or homeschool options. I know a lot of parents who chose to homeschool their children because of that. Of course, that's not an option for everybody, and I understand that. But if things are getting too extreme, there's no reason to just throw your hands up in the air and say, well, this is just how it is. Okay, there's always accommodations that can be made, either if it's just in your behaviors or trying to educate somebody else. There's always something that you can do. Okay. And you can also just change their activity or change their routines. If the child, again, we use the church example a lot, but if your child just can't handle a church service, maybe let them stay home on Sundays, right? Have, maybe somebody else stays with them while you go, or do online services or something like that. Okay, there's always ways to be creative. So how do we address real misbehavior, right? So we know that there's autistic behaviors that can be observed and labeled as misbehavior, but all children misbehave, okay? So how do we address that real misbehavior? Well, first you have to realize that if you're a capable guardian, you're not going to punish a child for age-appropriate behavior, right? Babies aren't going to get in trouble for crying. 2-year-olds struggle with toilet training. Tweens need help managing their time, right? But then on the other hand, you don't want to make it easy and acceptable for your child to lie or hurt other people's feelings or hit or behave in ways that are damaging to themselves or others. So we do want to modify expectations and change situations based on the individual, but everyone needs and deserves structure and limits, okay? So one way we can do that is we set and communicate limits and expectations. So hurting people physically or emotionally is not acceptable, regardless of the diagnoses, especially if it's done intentionally. Lying or acting out when someone can't control themselves everyone needs to know the limits and the expectations. And children with autism might need to learn about those limits very directly through instruction, visual tools, and social stories. Recognize misbehavior. You know that child in your care, right? So most of the time you'll know if they're intentionally lying or intentionally ignoring somebody or intentionally hurting somebody. So you know your child better than anybody else. So you know if they're behaving in a way that's inappropriate for their developmental capacity. Respond quickly and clearly. So if you catch your child misbehaving, you'll need to be extremely clear about the issue, be able to communicate why it's wrong and how you feel about it. So using sarcasm, the cold shoulder, or other techniques similar to that might be misunderstood or ignored altogether. And just a personal note from me, I feel like using sarcasm or cold shoulders in disciplining any child, neurotypical or otherwise, is usually ineffective. Next, provide meaningful and consistent consequences. So in the best of worlds, a child's misbehavior will cause its own negative consequences, right? So if you deliberately dump cereal on the floor, then that means you don't get cereal for breakfast, right? That's its own consequence. Consequences that are meaningful to a child, like to no TV allowed, can be very effective. And then offer support for improving behavior. I think this is very important, even just in discipline in general with your children. Make sure you notice when they're doing good things, when they're doing things right, and make a big deal out of it. If you make a big deal out of misbehavior, make a big deal out of, appropriate behavior too. That reinforces that job well done. So that could be earned rewards, like a small treat, or you could do high fives, or just, a big smile. And it's important to be responsive to that child when they behave well and be very specific about what's good in their actions. So you can say, honey, you did a great job sharing your toys today with your friend, right? So now we're going to address autistic meltdowns versus a temper tantrum. So it's very important to know that an autistic meltdown is an involuntary response to a nervous system overload, okay? It is a highly dysregulated state, and it is not behavioral, but a physical manifestation of a neurobiological reaction. So what that means is when your child is experiencing an autistic meltdown, they are experiencing a nervous system overload, okay? They're not losing control to be manipulative, okay? So an autistic meltdown is bigger, more emotional, longer lasting, and more difficult to manage than a temper tantrum. Tantrums and meltdowns have different causes. So a tantrum is typically a manipulation where the child tries to get what they want by crying, screaming, making a scene. But an autistic meltdown is not manipulative, and they are genuine cries of distress, okay? And I think it's very important for caregivers to know this, that it is not uncommon for people who have autism to have that system overload and behave in a way that might be viewed as a behavioral issue if it was a neurotypical child, okay? So early signs of a meltdown would be to start showing signs of distress. So that can be subtle, like biting your nails, asking to leave, or more obvious, like covering your ears with their hands, okay? So it's important to be aware that the behaviors are a response to stress and or sensory overload and not a form of manipulation. So if you see your child exhibiting autistic meltdown precursors, please be aware that your response to that should not be one of discipline. It should be one of compassion, okay? So autistic meltdowns will vary in intensity, and they might include biting, crying, destroying property, foot stomping, hitting, kicking, running off, also known as eloping, zoning out, self-injury, such as banging your head or hitting themselves or pulling their own hair, stimming, those behaviors we talked about earlier, throwing and breaking objects, vocal outbursts, including yelling, name-calling, sobbing, or intense screaming. So the meltdown occurs when the brain goes into fight, flight, or freeze mode from overwhelming emotions. We all have that system in our bodies. We all experience this when we're dealing with an overload or high distress situations, and it is involuntary and cannot be controlled by the individual with autism. And so they will often last at least 20 minutes beyond the removal of the initial trigger. So let's just say, for instance, there was a trigger because of maybe too much light or something going on like that, a sensory issue happened. Removing your child from that space, it's going to take at least 20 minutes for them to calm down. Okay. So after a meltdown, it can also take a while for them to recover. So we allow them time and space to regain emotional regulation. So they're highly dysregulated. They're going to need time to come back down. So in the aftermath of a meltdown, people with autism are often unable to recall the details of what happened, right? So we don't want to have to try to discuss their behaviors in the hours after the meltdown. Wait for them to really truly get back to their normal stasis before we have those discussions. And they might not remember. They might not remember pulling their hair or banging their head against the wall or kicking somebody. Okay. So if they don't remember the behavior, it's hard to try to have that conversation with them about it. So how do we prevent an autistic meltdown? First and foremost, we recognize the warning signs. So once it rises to that level of a meltdown, it can be difficult for them to calm down. So we want to recognize triggers before it gets too bad. So sensory overload is that common meltdown trigger that a lot of people with autism experience. That can be lights, sounds, smells, different textures, like a seam in their sock. Emotional overwhelm and stress can also trigger meltdowns. So if you know your child's triggers, you can find ways to avoid them or make them more manageable. So for instance, you can use essential oils or air fresheners to mask any smell that might be triggering them. Noise canceling headphones make loud spaces more tolerable. Soft fabrics that fit comfortably and sunglasses to block bright lights. Heed the warnings. So keep an eye out for subtle signs of overwhelm and take action to eliminate that cause or move the child to a calmer space. Signs of building stress can include anxiety, irritability, and stemming behaviors. And older children might be able to verbalize that they're getting overwhelmed. So when you see these signs, just take action. For example, a child who is overwhelmed by noise and light at the mall, they might calm down quickly when you take them outside. A child who's anxious about a social situation might need clear direction, reassurance, and support. So if intervention doesn't occur, though, it doesn't solve the problem. A meltdown is almost inevitable as the person becomes overwhelmed by their emotions. So the bottom line here is do not avoid or ignore if you see your child showing the warning signs of a meltdown. Err on the side of caution and get them out of that situation as quickly as you can, get them regulated, and then you can move on with your day. You can manage autistic meltdowns that are in progress. It's very difficult, but the best way that you can do that is to keep calm, right? You can co-regulate by providing safe and a calming presence. So each person with autism is unique, and there's no one technique that helps everyone, but there are some calming tools that you can try, such as calming music, a cold drink, compression, a cozy blanket, deep breathing, dimming the lights, distraction. Empathy and kindness, my two best friends, right? A favorite stuffed animal, fresh air, pressure. So that could be, you know, like a weighted blanket or a hug if they're older and they're okay with that. Maybe even just letting them punch a pillow to release some of that energy, rubbing their back, maybe just putting them in a silent space, you know, skin brushing, all these different things, okay? So you know your own child and you know what works for them. But these are just some tips if you need some a starting point. So of course, safety for both the person with autism and the other people in the area is important. Bolting, hitting, self-abuse, and screaming can be particularly frightening or even dangerous. And so it might be necessary to move your loved one to a quiet room until the meltdown is over. And especially if they're older, maybe bigger, you might need more than one person to help you do that to avoid injury, okay? So finally, I've got a few resources for you. childrensnational.org. If you go on that website and you click the tab Get Care, there's a ton of autism resources there for families. The Autism Parenting Magazine is also a great resource. If you go on their website, they'll offer you a free issue of their magazine, but there's also free articles on their website going over all kinds of different autism-specific issues when it comes to caregiving children and adults with autism. And then, of course, the old standard, the cdc.gov website, they always have up-to-date, accurate, peer-reviewed and clinical information and national resources. And I think that's a great website to start your baseline for research. There's all kinds of personal blogs and articles floating around the internet that are not peer reviewed. They are not backed by any type of science. And some of them do have good information, but I think it's good to get a baseline of accurate information so that way you're better equipped to kind of weed out misinformation. So that's all the information I have for you today. I know it was a lot. I hope it was helpful. And with the time we have now, I will go ahead and stop sharing and open it up for any questions, comments, insights that you all have about the information or just your lived experience that you'd like to share. No pressure, but the floor is open. All right. Well, I hope you all had some clarification maybe on what autism is. Maybe if you're raising a child or a young adult who has this diagnosis, maybe there's some information that you got today that will help you understand them a little better. Maybe some things that you can try to help calm them, soothe them. That's really the goal. And of course, I'm not the expert on autism spectrum disorder, but I do have lots of friends and family who have this diagnosis in their life. And so I just from a personal level would really love more people to understand the behaviors and kind of demystify the diagnoses and just know that, you know, people with autism are just people. They're just regular people who maybe just need to navigate the world a little differently than a typical person. And that's okay, right? All right, so we are past 11, so I'll go ahead and end the meeting today. But if you're interested in joining further meetings and you're not you're not getting that newsletter, you can go on our website, alabamarespite.org, and attend caregiver events. Just click on that, and there's a bunch of our upcoming events you can register for. And then also you can sign up for our newsletter, and it'll get sent to your email every month so that you know what's coming up, so you can register. And we've got a support group on Friday. If you're interested in joining, please register for that. We're going to talk about self-love for our Valentine's Day theme. And so I hope you all join me for that. And again, if you have yet to do so, please put your email in the chat so that I can send you the post survey. And I'm so thankful everyone joined today, and I really hope that this was good information. And if you have a loved one or a family member who maybe doesn't understand this diagnosis, and maybe you know, maybe grandparents who think your children are just misbehaving or what have you, please send them the link to this recording so that they can get on the same page with you. Because sometimes it's, you know, it can be a little frustrating, right? Sorry, was somebody saying something? I was talking over you.
Hold on 1 second. Can you sit? Can you put this a second?
All right.
I'm gonna zoom in the ear. Hold on.
All right. So I'll go ahead and end for today, everyone. Thank you so much for joining. And I hopefully will see you all on Friday. If not, I'll see you next week, I'm sure. All right, Vanessa, I will send that to you. Thank you. All right. Bye-bye, everyone.